Saline solutions, how often should you use it?
I think it really depends upon your exposure. And it depends upon if you have an allergy to dust. You're going to be exposed to dust all the time. If you're going to clean your house, I think you should open the windows if it's not minus 32 in Minnesota, so that you can let it air out. So if you're in a dusty environment, you have allergies to dust, I think you should do it at least once, possibly even twice a day. If you're having hay fever, if you like to garden and you have problems with grass, and you have perennial grass and the pollens or the flowers during the springtime, then if you like gardening, there's a couple things you can do. You can immediately, when you come back in, you can irrigate your nose with a saline solution. Or there's something that's over the counter, which is called nasal prom. If you know that you're going to have an effect or an exposure from something that you know that you have a reaction to, if you spray it before you have an exposure, it decreases the antihistamines so that you have less of a reaction. And so the answer to the question, I think it really depends upon your exposure. I have patients that are construction workers that are around a lot of dust and irritants, so I tell them do it 2 or 3 times a day. So you can do it in the morning before you go, do it during your lunch break, and I would tell them when they go home, and once they change out of the dirty clothes from construction, because the dust is still there, change, wash it out, so it doesn't stay and cause more inflammatory processes. Any other questions?
This sounds like such a superior procedure. I'm surprised you've only done 30 in a couple of years. Are there a lot of people who aren't candidates for this kind of procedure?
I think part of it is probably more marketing than there is anything else. And actually, I'm going to bring this technology here to Coronado, which is one of the things that we're doing, is to let everybody know what is out there. As far as there being more people that can do it, there's certainly a lot of people that can do this procedure. Not everybody's trained to do it. It's kind of interesting because here at UCSD, they don't actually do this technology. Part of it is they're not convinced by some of the data that's out there, and actually a lot of the data that's being done shows that, again, that there's lower complications utilizing this type of technology than there is using the more conventional microdebriders or the forceps. So with regards to the question, I think as people understand more and more what they're looking at versus the options, I think they will likely look at something that's like this, that is safer at this point in time. Now again, having said that, if you have multiple other medical issues, you may still have something that's conventional, like a septoplasty that's done. No balloon's going to move over your septum and keep it over there. That requires an incision. That requires possibly removing some bone, possibly some cartilage as well, so that you can keep that in the midline so that you can actually get to these places so you can also go ahead and breathe well. With regards to the turbinates, which I didn't really define for you, but think of the inferior turbinates as serving 3 main functions. They're pre-filters. They grab the large particles. They also moisturize the air that you breathe in, and they also bring the air closer to body temperature. What happens is those swell up, and if they swell up, those can plug your nasal passages and cause you more problems. You may have more of the rhinitis problems that this young lady was talking about before, as opposed to the actual true sinusitis. So again, I think a lot of it has to do with patient selection. You really have to make sure that this is something that's appropriate for them. Studies now are showing that the ethmoids are starting to clear up. Those studies are relatively new, and so that was one of the things that I was somewhat hesitant about using this, is that if you had a lot of ethmoid disease, I thought, well, it wasn't necessarily taking care of the ethmoid disease, and I didn't have any data to really back that up. But as the data is starting to come more and more, I don't have to look at just somebody who has just one sinus that has an issue. And many patients have multiple sinuses that have issues. So again, it comes back to patient selection, finding out what's tailor-made for the person that has the issue at hand that needs to be solved. Does that answer your question?
Well, yes, but also, could you describe, if you would, to do this, exactly what is the procedure? Is this done in the hospital, in the office? How long does it take? What kind of sedation?
Right. It depends again upon what is found. So let's just say that there's only sinus problems. Okay, let's say it's just the left maxillary sinus. And you have a perfectly straight septum and there's great exposure. This can be done in the office. Okay? It can be done in the outpatient surgery center. Okay? And you don't have to be put completely to sleep. Okay? If you prefer to be put to sleep, that certainly can be performed if that's something that you have an anxiety towards moving possibly. So to answer the question, there are going to be some people, this can be done in an office setting. There's some people that can have this done in with just local sedation in the hospital. Okay, there's going to be some that have more extensive problems and they're going to require general anesthesia. But what this does is this expands our options to treat a person and tailor the techniques to the individual needs. Did that answer your question?
Yes, and one more question.
Sure.
I've been told that in order to properly diagnose sinus problem, it's necessary to have a CAT scan, and I'm very concerned about CAT scans of the head, and I wonder if that is really true, that it's necessary to have a CAT scan.
Well, it's certainly helpful, okay? And I would say in this day and age, it would be very, very, very helpful. When we are surgeons, we use the CT scans as roadmaps. And so it's like asking a person to drive without a map. And you're telling them to go to a certain destination. In this case, the destination is making you better. So the question is if I don't know where the dead ends are, if I don't know where the dangers are, if I turn down the wrong way, I can cause more harm than good. So then what we have to do is we have to say, let's assess the potential risk of not having a CT scan versus your concerns of the CT scan. And the risk with radiation for the CT scan versus the risk of a complication of sinus surgery. Some of the risk of the sinus surgery complications, if you haven't done a lot and you don't know where the problems are, blindness, CSF leak, double vision, severe bleeding, life-threatening bleeding. These are just some of the issues. I will also tell you that before, back in the 80s, one of the most dangerous ENT operations performed was the ethmoidectomy, because it was before the endoscopes. It was a blind procedure, and there was ethmoid curettes that were in a triangular shaped form. And so it was essentially the same thing. It was asking the surgeon to do something without really good roadmap, without the high resolution. So I would strongly suggest that if you were considering to have sinus surgery, that you weigh the risk of the radiation, which nowadays is relatively minimal, because there are different ways they can actually use lower radiation in shorter term. But if you had a lot of exposure to radiation, then you have to take that into account. If you've had lots of body CT scans in the past for various reasons, you have to weigh that exposure. Then you have to weigh the risk versus the problem that you have. And again, I think that goes back into that other slide that I had, where the problem goes over and over again. Try the medications, do this. And so I think what we have to do is we have to look and say, what's the problem? What's the safest way to address the problem? And what risk factors are if we do or do not do something, and explain those. Does that help?
Thank you.
Any other questions? Well, I want to thank you for your enthusiasm and the questions, and there were all a lot of excellent questions that allowed me to give you some more information that I hope was useful for you. And I want to thank you for your time, and also I want to thank Sharp Hospital and the Foundation for the use of the facility.